Hello guys, welcome and welcome to Metier International Academy, one of the leading academy in training nurses and the nursing competitive exam as well as IELTS and NCLEX and OET training. And in today's session, we are going to discuss an important topic which is already asked many times in the previous year question paper like NORCET, AIIMS, JIPMER. So let's continue with the magic pill session. Please watch the session till the end. Definitely it will be so much useful for you. And if you are watching the channel for the first time, please subscribe the channel. And if you like the video, please like it and share it to others also. So let's begin the session without wasting the time. So the first question is, and if you like the video, please like it, share it. Okay. So the first question is, while feeling the pulse, when the beat is skipped, it is referred to as. It is a direct question. And here the key point, what you're supposed to observe in the question is skipping of the beats. While you are palpating the pulse in the radial artery, there is a skipping of beats. In other words, we can say it as missing of beats. So in this condition, it is called as what? And here they have given four options like irregular pulse, dichotic pulse, intermittent pulse, and regular pulse. You should know the definition of everything, then only you can understand and give the answer exactly. So here the right answer is, if there is a skipping of beats in each cardiac cycle, it is called as intermittent pulse. Each cardiac cycle, what is happening? Missing of beats is present. So it is called as what? Intermittent pulse. So what is intermittent pulse? One more keyword you're supposed to remember whenever you are coming across the word intermittent pulse. The first one is skipping of beats. Okay. And second one is at a regular intervals, there is a skipping of beats. See, each cardiac cycle is giving a pulse. Okay. In one cardiac cycle, one pulse will be there. First, you should understand that concept. Okay. One cardiac cycle, one pulse will be there. If the heart is pumping, cardiac output is there, and the heart is and the blood is overflowing in each and every part of the body, it's because of the pulse. The pulse is nothing but the artery which is pumping the blood forward. That is called as what? Pulse. So in each cardiac cycle, one pulse will be there. Okay. So this is the normal mechanism. So here in this question, what they are asking is skipping of beats in every cardiac cycle. Okay, at a regular intervals. These three key points are present means then you have to go for what? Intermittent pulse. Once again, I will repeat, skipping of beat. That is the first key point. At every cardiac cycle, at a regular interval. What is the meaning of regular interval? Every second beat is missing. Every first beat is missing. Okay, so it is happening regularly. So that is called as what? Intermittent pulse. One more definition is also there. That is for option B. That is dichotic pulse. It is also called as what? Double pulse. What is that? Dichotic pulse is also called as what? Double pulse. Why it is called as dichotic pulse or double pulse? Here you can see, I have given in the graph also. You can see this graph. This graph will be more better when compared to this one. See, in the heart cardiac cycle, two things are very important. That is systole and diastole. So, in dichotic pulse, during systole also one beat will be present, and in diastole also one beat will be present. So two beats will be present in one cardiac cycle. Two beats will be present in one cardiac cycle. During systole also one beat is present. In diastole also one beat is present. If these two beats are present in a single cardiac cycle, that is called as what? Dichotic pulse. It is also called as what? Double pulse. Hope everyone understand the concept, right? Fine. One more pulse is see, today we are going to discuss about each and every pulse. Okay. Different abnormal pulse we are going to discuss in detail. So the next one is anarchotic pulse. Anarchotic pulse. It is also called as pulsus tardus. Just now we discussed about dichotic pulse. It is mentioned here. Dichotic pulse is also called as pulsus dichoticus. So in the exam, they will be either asked in dichotic pulse or they might be asked in the words with pulsus dichoticus. So whatever the word is coming, you're supposed to answer the question. Okay. So now let's discuss about anarchotic pulse. It is also called as pulsus tardus. This is the first key point. And second key point is there is a slow rise and slow fall. Okay. While you are palpating the radial artery, you can feel a slow rise and the slow fall of the pulse. And the duration of the pulse will be prolonged. So these are all the two key points you're supposed to remember. And third one, in which condition this type of pulse will be there? In aortic stenosis, this kind of pulse will be there. That is anarchotic pulse or pulsus tardus, commonly seen in aortic stenosis. Slow rise slow fall. First key point. Second key point, duration of the pulse is prolonged. These 2 points are coming means you have to think about what? Anacrotic pulse. Okay. So the next question is the jerky pulse. This is the key point. Direct question. Key point is jerky pulse with full expansion and sudden collapse. With full expansion and sudden collapse. While you are palpating the radial artery, you can feel the artery very well. Suddenly there will not be any pulsation. Suddenly you can feel the pulsation. Suddenly there will not be any pulsation. Understand what I am saying? So with a full expansion, you can feel the pulse, and after that, sudden collapse of the pulse, that time you cannot feel the pulse. Okay, so this is called as what? Jerky pulse. So this type of pulse is called as what? This type of characteristics is seen in which type of pulse? Anacrotic pulse, Corrigan's pulse, running pulse, bounding pulse. 4 options they have given here. Among these, the right answer is option B, that is Corrigan's pulse. Option A, anacrotic pulse, just now we discussed. Slow rise and slow fall. That is called as anacrotic pulse. Okay, already we discussed about that. The next one is Corrigan's pulse. There are different names for the Corrigan's pulse, guys. Corrigan's pulse, water hammer pulse, collapsing pulse, everything I have mentioned here. Okay, so here what is happening, you know, the physician is holding the hand, okay, holding the hand like this. Suddenly he is lifting the hand, holding the hand and suddenly lifting the hand like this. Okay, so what is happening, you know, you see the second point, rapid upstroke. See, the physician is holding the hand like this. Actually, the physician is palpating the radial artery. Suddenly he is lifting the hand like this. Okay, while lifting the hand, first he will feel the upstroke, means he can feel the artery very well. Okay, he can feel the artery very well. And after that, because of the hand in this position, the peripheral resistance will increase and the second pulse will be downstroke, very less palpable. First stroke will be upstroke and second stroke will be, the patient has to keep the hand like this. Okay, the first stroke will be upstroke and second stroke will be downstroke because of the peripheral resistance. Understand what I'm saying? So upstroke, downstroke, these are all the key points. So if it is present means, then we have to think about what? Corrigan's pulse. Okay, so upstroke means with full expansion. That is what mentioned in the question. Okay, easily we can feel the pulse. And sudden collapse means downstroke. Sudden collapse means what? Downstroke. Okay, so both the words are present in the question. So directly we can go to the answer. What? Corrigan's pulse. It is also called as collapsing pulse or water hammer pulse. Okay, see what is bounding pulse? Very simple. If you are doing heavy exercise, I have given the image also for collapsing pulse. Okay, just check it out. Bounding pulse, very simple, guys. If you are doing heavy exercise, for example, if you are doing cardio exercise, you are running for continuously 15 to 20 minutes. While you are running, you can feel your heart rate or the pulse rate in your ears. Yes or no? While you are running, if you are palpating your carotid pulse, it will be bounding. Even just touch like this, you can feel the pulse. Understand? Yes. So this is called as what? Bounding pulse, because the heart rate is increased, the contraction of the heart is increased, the pulsation also increased, and the blood is circulating everywhere all around the body in a fast manner. This is called as what? Bounding pulse. Is that clear, guys? Fine. Now we are going to discuss about each and every pulse in detail, because pulse you might guess exams. Even the diagram it is given here. So image based question, you can just coordinate with this. Okay, the first point what we are going to discuss is pulses paradoxes. See, 2 types of pulses paradoxes is there. First one is the normal pulses paradoxes and second one is reverse pulses paradoxes. So pulses paradoxes means during inspiration, decrease in the systolic blood pressure. How much decrease? 10 to 12 mm of mercury decrease in the what? Systolic blood pressure. What is the normal systolic blood pressure? 120, right? So during inspiration, the 120 is decreased to 110 mm of mercury, means it is because of what? Pulses paradoxes. Here the key point is during inspiration, decrease in the systolic blood pressure. That's all. How much decrease? Less than 10 mm of mercury or 12 mm of mercury. That's all. So the first point is over. The second point is reversed pulses paradoxes. Reversed in the sense just opposite to the pulses paradoxes. During inspiration, increase in the systolic blood pressure. During inspiration, increase in the systolic blood pressure. Okay, that is called as what? Reversed pulses paradoxes. So two important points are over. The third classification is pulsus parvus et tardus. The name is like this. Okay, you can keep it as pulsus parvus or pulsus tardus. Nothing to worry about that. Okay, so here what is happening, you know, a slow rising pulse is present. While you are feeling or palpating the radial pulse, the pulse will be slowly, it is rising and going down. Okay, so slow rising and going down means it is called as what? Pulsus parvus or pulsus tardus. In which disease condition these characteristics pulse will be present? Everything is mentioned in the last column. Just go through it. For example, pulsus parvus, this condition is seen in aortic valve stenosis. Pulsus paradoxus, it is seen in cardiac tamponade, pulmonary embolism, asthma, emphysema. Like that, the disease is also mentioned here. Just pause the video and check into it. Okay, fine. The next pulse is pulsus bisferiens. So here you can see that usually the students used to get confused between pulsus bisferiens and dichotic pulse. These two things are confusing, right? Very simple example, let me give to you. In pulsus bisferiens, only a single peak will be there. What is the meaning of peak? This is not peak. Okay, here you can see a single peak. But in a single peak, two peaks are present. This is the first peak, this is the second peak. பார்க்க ஒரே பீக் மாதிரி தான் இருக்கும். ஆனா அந்த எட்ஜ்ல பாத்தீங்க, அந்த மேல எட்ஜ்ல பாத்தீங்க அப்படின்னா ஒரு ரெண்டு பீக்ஸ் இருக்கும். Okay, in single pulse, two peaks are present. In a single pulse, two peaks are present. This is called as what? Pulsus bisferiens. It is commonly seen in aortic regurgitation, digitalis toxicity, okay, hypertrophic obstructive cardiomyopathy. Okay, so these things you have to memorize it. Okay, and the next one is dichotic pulse. See, in dichotic pulse already we discussed very clearly about the dichotic pulse. In systole also one beat will be present. In diastole also one beat will be present. That is called as what? Dichrotic pulse. Commonly seen in cardiomyopathy, cardiac tamponade, typhoid and dehydration. Next one is pulsus alterans. Very commonly asked question. Most of the time pulsus paradoxus, pulsus alterans are asked in the exam. Even the Waterhammer pulse asked in the exams. So pulsus alterans means the first pulse will be very strong and second pulse will be very weak, and third pulse might be very strong, fourth pulse will be very weak. So there is an alteration, right? For each and every pulse there is an alteration, right? That is called as what? Pulsus alterans. And the next one is Waterhammer pulse, Corrigan's pulse, collapsing pulse. Already we discussed about that. It is commonly seen in the aortic regurgitation. And the last one is hypokinetic pulse. It is nothing but a small weak pulse. You cannot feel it also. Okay, so this one commonly seen in shock, especially hypovolemic shock. Okay guys, so these are all the different varieties or classification of the pulse. Okay, so definitely if they are asking questions means only they can ask question from this area only. Question கேட்டாங்கன்னா pulse related இங்க இருந்து தான் கேட்க முடியும், வேற எங்க இருந்துமே questions வந்து வராது. சரியா? So the next thing is the difference between apical and radial pulse is called as. What is apical pulse? Apical pulse is the one, it is commonly felt in the left ventricle. Okay, in the tip of the left ventricle, that is called as what? Apical pulse. And the difference between the apical pulse and the radial pulse is called as. They have given 4 options: pulse deficit, pulse amplitude, rhythm deficit, or amplitude. Among these, the right answer is what? Pulse deficit. Most commonly asked question is this one. What is pulse deficit? There is a difference between the apical pulse and the radial pulse. That's all. These are all the 2 key parts. If there is a difference between the apical pulse and radial pulse, then it is called as what? Pulsus deficit. Okay. The next one is, for every 1 degree Fahrenheit rise in temperature, the pulse rate increase by 20 beats per minute, 15 beats per minute, 10 beats per minute, 5 beats per minute. Among these, the right answer is 10 beats per minute. What is the right answer? 10 beats per minute. It is a direct question. Okay, see, the pulse rate increases 7 to 10 beats per minute if there is a rise in 1 degree Fahrenheit temperature, the pulse rate increases 7 to 10 beats per minute and the respiratory rate increases 4 beats per minute. Understand? If the temperature is raised 1 degree Fahrenheit, in pulse rate and respiratory rate, some changes will be there. That is, the pulse rate will increase 7 to 10 beats per minute and respiratory rate will increase 4 beats per minute. And the next one is when the pulse rate is irregular, it is best count the. See, consider the pulse rate is irregular. Pulse rate வந்து irregular-ஆ இருக்கு. ஓகேங்களா? So, இந்த மாதிரி irregular-ஆ இருக்கிற சிச்சுவேஷன்ல எந்த பல்ஸை வந்து நம்ம ஃபீல் பண்ணலாம், எவ்வளவு நேரம் வந்து ஃபீல் பண்ணலாம், இதுதான் கொஸ்டின். So here the right answer is what? Option B, that is apical pulse for a full minutes. You have to feel only the, you have to palpate only the apical pulse for a full minutes. Is that clear, guys? So hope everyone understand each and every different types of pulses, and the question which so far asked related to the pulses, I have covered those things also. If you have any doubts anywhere, you can drop your message in the comment section, and thank you very much for watching the video. Please watch this video again and again, because the session whatever we are discussing in the magic pills is very, very important, because the exams are arriving, it is very nearby, so definitely revision is mandatory. So these kind of questions already asked from the previous year question paper, taken from previous year question paper. So watch the video again and again, okay, so that it will store in your mind. So thank you very much and all the best for your upcoming examination, guys.